Okay, well, the meeting is now live, Chair.
Thank you very much. Welcome to today's meeting. I'm Councillor Ian Mason, the Vice Chairman. I've got apologies from Councillor Ian Holder, who is the Chairman, who wasn't able to make it today. Do we have any other apologies to note?
I'm not aware of any. No, I haven't received any.
And we also have the apologies from Tracy Redman, who was unable to send anyone from the South Central Ambulance Service, as all their resources are focused on patient care and patient safety. If we go round, declarations of interest from anyone? No? In which case, if we go round and if I call you out in the list I have you on my screen, if you just introduce yourselves briefly. If you're not talking, it would be grateful if you can keep yourself muted. But if I could call first Councillor Arthur Agate.
Thank you, Chairman. Arthur Agate. I am here on behalf of East Hants District Council.
Thank you much. Councillor A. Briggs.
Good afternoon, everyone. I'm a county councillor for Waterlooville and North Stakes, and I'm here. I'm vice chair of the Hampshire HOSC. Thank you.
Thank you. Councillor Cartwright.
Yes, good afternoon. I'm Deputy Leader and Exec Member for Health and Public Protection in Fareham Borough Council.
Councillor Lynn Hook.
Hello, thank you, Chair. I'm Councillor Lynn Hook and I represent Gosport Borough Council.
Councillor Roger Bentot.
Hi there. Yeah, I'm present. I represent Winchester City Council. My ward is based in this southern area of Winchester, so I represent Shedfield and Curdridge and Whiteley.
Thank you. I believe that's all of the councillors. I'll now go through officers. So, Jane Dodino.
Yes, I'm present. Jane Dodino, Local Democracy Officer.
Karen Martin.
Good afternoon, Karen Martin, Local Democracy Officer, observing this afternoon.
Thank you. And if we go through the outside parties as well, Simon Nightingale.
Hello, my name's Simon Nightingale. I'm Assistant Director for Health and Care Partnerships here for Andy Biddle.
Thank you much. Susanna Rosenberg.
Susanna Rosenberg, Chief Operating Officer at Solent NHS Trust.
Thank you much. And Joe York.
Thank you, Joe York, Managing Director, Health and Care Portsmouth, and a joint role between Portsmouth CCG and the City Council.
Okay, thank you very much. I think the way we've tried to operate it is if people stay muted when they're not actually involved actively speaking, and where possible, if all members can keep their cameras turned on. Okay, moving on to item 4, adult social care, and Simon Nightingale, please.
Thank you very much. I won't go through the report verbatim, but instead will give a summary and can take questions as we go, if that's acceptable.
Yeah.
So the purpose of the report is to update the Health Overview and Scrutiny panel on the key issues for adult social care for the period of May 21 to October 21. An overview of the work of the services included within the report, along with national guidance that has been issued during the pandemic that the service is obliged to follow. The government's proposed national reforms to social care have been summarised within the report, and furthermore we're expecting 2 white papers this calendar year relating to furthering the integration and transformation of social care agenda. The report highlights developments and challenges related to hospital discharge. There's current additional work, with planning within Portsmouth, South East Hants and the wider footprint around our hospital, the QA, that have recently been put in place. Adult services are supporting the work alongside NHS Solent colleagues due to the integrated nature of our services that support the hospital. Happy to go into more details there if you would like. The report highlights developments and challenges in working with people with a learning disability and informal carers. goes into detail, and also highlights the risk management approach that's been taken for our management information capability. This is where we get all our reporting, get the data that drives our decision making, that we're trying to strengthen at the moment. The report also summarises the informal inspection process in place for directly provided care home support. The report outlines some of the demand pressures that are currently impacting on adult social care and the challenges for independent providers of home care services, domiciliary care, in the city and around occupancy within care homes, nursing homes. In addition, the work of deprivation of liberty safeguard referrals, the approved mental health professional service and adult safeguarding service is also summarised within the report. And finally, an overview of the annual complaints report for adult social care strategy as well provided, and the report concludes with a summary of actual and anticipated risks currently faced by the service. Happy to go into more detail of any item if anyone would wish.
Any members have questions? I can see Councillor Lynn Hook, if you want to go first.
Thank you. It's just on the discharge, certainly from QA. I believe that some can come over to Gosport and some go over to St Mary's. Is that still the case, or are we still very nervous about COVID and whether or not they are going to these places?
When you say discharges, and you mentioned Gosport and St Mary's, there's around the discharge to assess bedded capacity that's in place. So it would be Clarence for Hampshire, and it'd actually be Southsea unit within Harry Sonic Nursing Home in Portsmouth. Is that what you're referring to?
I've got one over here in Gosport, which is a care home as such, and they help out occasionally when needed.
Yeah, so that's probably the discharge to assess units that we have. So no, there's no problem with accessing them. There's problems with keeping them staffed appropriately. There's a lot of pull on similar kind of nursing carer type staff. So we're trying to increase, as Hampshire for Clarence and we are for Southsea in Portsmouth, trying to increase our discharge to assess beds. There's now and again, because they're in a care home, some people decline to go into them because of the stigma that can sometimes be attached to a care home environment. So we make it very clear that it's not a care home while people are going there. It's for a specific discharge to assess, help people to plan onward their onward care journey. And it's similar to the community beds that NHS Solent have, for example, in Portsmouth. They're also increasing beds to support the discharge to assess pathway out of QA. So yeah, they're being used, they're being fully utilised, and we're trying to get more, to be honest, to help with the pressures.
Good news, thank you.
Thank you.
Any other questions from members? In that case, I think you managed to cover everything in your report. So,
thank you very much.
Thank you very much. I spoke too soon. Councillor Briggs.
Thank you. Is it now working? Are we getting people discharged quicker? Are they getting the information they need when they're admitted? Are you now able to do a care plan while they're still in there to get them out quicker, to save the backlog that QA is having?
So it's often, so yes, as far as I can assure you, as far as I'm assured myself, people are being given the right information and being given letters upon entry, but also as part of leaving the hospital. But in terms of care planning, it's only the initial care plan that's discussed within the hospital that will help that individual to leave the hospital in a timely and safe manner. Before, when there was a lot of services on site at QA, the care planning part was causing quite a delay, to do it properly, to do the full care act assessment, and I often saw the people that we were responsible for supporting stay for approximately five days, I think, on average. Now, with the new discharge guidance that came in April last year. And obviously because of the pressures, we've changed that, and now the majority of the care planning and the full character assessment happens outside of the hospital, which is why we stood up the discharge to assess beds and capacity. It's not all beds, it is additional care home capacity as well. And that's where the care planning really takes place. We have specific teams that respond while people have been discharged to assess, to rapidly work with them and their families to put in their longer term care arrangements.
Thank you.
No, thank you.
Any more questions?
Chair, if this item's finished, may I just remind you that you'll need to consider the meetings of the previous minutes when you have a moment.
As discussed with you, I think we're online meetings, we can't actually make decisions, so I'm going to just send them over till we actually have a person meeting.
Okay, I'll just note that you've asked to defer them. You do have the power to agree them, as you did in the last meeting, but if you wish to note them or defer them, that is fine.
The meeting before we didn't agree them, so...
Sorry, Chair, could I just chop in there? I would appreciate going through the previous minutes. There are a couple of items on there that I thought perhaps we might get updated on.
You go through them, but I'm not happy to
had a
approve
look
them
at,
without...
Sorry, I do apologise. I just had a look at the 16th September minutes, which were attached to your agenda, and they do state that the previous minutes were agreed. Obviously, I wasn't there, but that's what's on there.
Well, we didn't actually do it, so that must be typed in wrong. Is there something in the minutes you wish to raise then? Councillor Agate?
Yeah, as and when you're prepared to go through it. If you want to do the rest of the agenda, by all means, carry on.
Okay. We'll come back to that at the end then. Next report is the South Central Ambulance Service. As has been already said, Tracy Redman, Head of Operations, is unable to attend nor send anyone else. So we can't actually ask any questions of that. Though if you wish to ask questions, I'm sure Jane will be happy to forward them back on. And I have sent you a separate email, Arthur, with the email address you've requested.
Thank you for that. It was that I had a defibrillating course on Monday, and I was going to have a word with Jane about it, but I can do an email. Thank you.
Is there anything that anyone wants to raise on that report? Okay, moving on to item 6, Southern NHS Trust update.
Chairman, I've actually got my hand up at the moment.
Oh, sorry. If you're able to put the RTS in the chat, it's easier to see, but Councillor Cartwright.
Yeah, no, I was just going to say, with the news we've been getting on the South Central Ambulance Service recently, I just wonder, perhaps, at their leisure, they could perhaps just give us an update on that particular situation.
Yeah, I think that might be why they haven't come along today.
I'm sure you're right, but it's probably important they stay away, but I think we would like an update, actually.
Yeah. Is there a wording you wish to put forward? I'm happy to second it.
No, I think just what I've said, I thought Jane got it, but I think that covers it, just an update.
Yes, sure, I'll invite them to the next meeting, Chair.
Okay.
Thank you.
Any other? In that case, if I hand over to Susanna Rosenberg from the Southern NHS Trust, please.
Thank you, Chair. So you have the report in front of you. I just wanted to draw your attention to two particular sections. The first was Jubilee, because we have been talking to you about Jubilee for quite some time. So we are doing some work with Portsmouth City Council to try and work through what the optimum bed configuration is for the city to meet the needs of our residents and also to support PHU's flow, which is the issue that you've been talking about just now. However, now does not seem like the right time to embark on a big change process, which will see that reconfiguration happen. The immense pressures at PHU and for the ambulance service means that we will continue to run Jubilee as it is. And in fact, we may well be looking to open the East Wing like we did in the previous 2 years for additional surge capacity to help with discharges. And then the other item to highlight to you is the work being done in our vaccination programme, and we've given you a lot of information there about all of the things that have been happening to support the vaccinations.
Sorry, Susanna, may I interrupt you? I'm getting a noise through like a ringing mobile phone. Is that somebody? I know it's stopped. If everybody could just turn off their microphones, maybe, if they're not speaking. So it was interrupting the meeting. I couldn't quite hear Susanna. Sorry, I'll let you go.
Sorry, yeah, I just wanted to draw your attention to the vaccination programme that we've been running from Hamble House in Portsmouth, and we've been running 3 other sites as well in the county, and the amount of vaccinations and outreach work that we've been doing to try and make sure that access to vaccination is available for all people, irrespective of where they live and where they come from. Happy to take questions.
Thank you much. Do we have any questions from members? I've got a couple of comments, but I'm happy to let other people go first. Okay, I'll go with mine in the meantime. Interested to see the collaboration with Portsmouth Football Club. Just really wondering how that's gone, and has it gone live yet?
So it has done. We've done the filming for the support for our patients with members of the football club. I will try and find out actually whether there's anything else that we could provide you so that you can actually have a look to see what has happened. We haven't had any evaluation on that or any patient feedback yet, and I'll also see whether I can get you that for a future meeting.
Okay, were the videos just be sent to specific people, or were they made live on the website?
No, they weren't. They are individual fitness videos to support people's rehabilitation. Yeah.
Okay, that's why I wouldn't have seen anything about it.
No.
Thank you very much for clarifying that. Other members' questions?
Just put one on the chat.
Yeah, we're really pleased with the international recruitment, and for us in Solent, it means that we have gone to a position where we constantly used a lot of agency registered mental health nurses, and now we don't need to use any at all. So that's amazing for us, and the calibre of the nurses is really high. These are nurses who have a whole range of additional experience alongside their mental health experience, and are usually dual trained.
Will you keep this up? Will it keep going?
Yes, definitely. Yes.
Good. Nice to hear.
Thank you much. And the Harbour Mental Health Service, is there a drop-in element of that, or is it purely on the phone text?
It's phone, yeah, it's virtual only, Harbour.
Any other questions from members? I'm looking around the screen and looking in the chat, so I'm going to zoom up. Thank you very much for the report. Would be interested to hear how the football club collaboration has gone forward. I think I got the wrong end of the stick of it. I thought it was sort of being outreach, but it's still good to hear that they're involved in doing work. So, thank you much.
Thank you very much.
Thank you. Moving on to Portsmouth Clinical Commissioning Group and Healthcare. What's an update? Jo York.
Yeah, thank you. Again, hopefully the report covers most of the areas of the CCG work that councillors will be interested in. I think the 2 areas I'd like to draw your attention to, the first is around the system pressures, and the second is just in relation to primary care as well in the city. So if I talk about the system pressures first, that may also provide you with some of the update perhaps that you were looking for from South Central Ambulance Trust. As you will be aware from media coverage, we continue to see significant ambulance handover delays at Portsmouth Hospitals Trust. All partners are working incredibly hard, as both Susanna and Simon have alluded to. Portsmouth City Council and Solent are working incredibly closely with Portsmouth Hospitals Trust, South Central Ambulance, alongside colleagues in Southern Health and Hampshire County Council as well. And we're also working very closely with our primary care colleagues as well and have agreed a shared action plan, recognising that this is a complex issue that we all need to support. It's not the fault of any one partner in the system. So the plan that we are looking at is really to how we can rapidly reduce those ambulance handover delays, which we recognise are inappropriate and risk harm to patients. So we are looking at, I guess, three main areas around ensuring that we are only conveying patients to QA that absolutely need to go to QA. So lots of work being done by community partners with the Ambulance Trust to step up efforts to care for people in the community. We are also working very closely with the primary care alliances in Portsmouth and South East Hampshire to redirect walk-in patients to clinical assessment services. So again, encouraging patients to phone and use the 111 service, but also the clinical assessment services will pick up patients who, having dialed 111, are given a what we call a emergency department disposition or a lower level ambulance disposition. So those GPs in those services call back those patients and are very good at what we call revalidating those patients and managing their concerns either online or over the telephone or with a face-to-face appointment in primary care. And then again, we're also looking at how we can do that if patients have arrived at the emergency department, and we can redirect them back into primary care using those clinical assessment services. Portsmouth Hospitals Trust have extended the emergency department. They've created an emergency care centre, which gives additional capacity, again, for patients who perhaps don't need a majors bed. And we're also doing a lot of work with them around increasing capacity at the front door and senior decision makers, and a move to what we call same day emergency care alternatives rather than an admission to a bed. And again, community colleagues are supporting that. We're also looking at flow through the hospital, and as Simon's already mentioned, discharge, increasing discharge capacity, both in terms of availability of beds, Susanna's mentioned keeping Jubilee House open, but also looking at our processes so that we are moving people through as quickly as we can, as safely as we can. So there's a huge amount of work going on with all partners around that to resolve that situation as quickly as possible, recognising that it's complex and that some of it is around bed occupancy in the trust, and that their new additional ward capacity is due to come online just after Christmas. So again, which will contribute as well. So I just wanted to draw members' attentions to that. And then the only other thing from the report was just to look at primary care capacity in the city as well, and the work we're doing to strengthen primary care capacity and work with all the GP practices and through the Alliance to support them and look at workforce, create additional workforce into the city, and obviously provided some information around face-to-face appointments, and also to members some specifics around the work the Portsdown Group have been doing as requested following the merger of the Hamray Road practice in 2020. again, as a big practice concerns around access, the report just highlights the range of work that the practice are doing to improve access to their services with patients. So thank you. They were the only areas.
Thank you. I've got a question from Councillor Hook. Well, just to declare a quick interest, since you mentioned Portsmouth Park in particular, Portsmouth Group in particular, but I've, as a ward councillor from one of their sites, my mailbag's gone through the roof with complaints about them, and I can't say I've had a great experience myself, so I wouldn't really say they're improving their service at the moment, but I'll hand over to Councillor Hook for your question.
Lovely, thank you, Chair. Thank you, Joe. Just a very quick one on 111. I did write to the CCG. We had lots of problems with people trying to get through to 111. They was waiting on the line. After 12 minutes, they were cut off. They redialed. After 12 minutes, they were cut off. And that was the reason for people turning up at any ED department without having any reference numbers or anything, because they couldn't actually get through to 111. And I haven't had an answer back to why that was happening at that time. So I didn't know whether you had any update on that, please.
When was it? Was that sort of over the summer?
It was a Saturday night, but it was about 9:20, so it wasn't particularly. Maybe it was busy. Probably about 3 month ago.
Okay, yeah.
And I had suddenly loads of residents all saying the same, and they kept getting cut off.
Yeah, I think we are seeing, and you will have seen, the NHS is experiencing significant increases in demand. That's happening nationally and locally. We have recognised that, and I think certainly over the summer particularly there were some capacity issues within the NHS 111 call handling service. That they have received some investment and have strengthened that call handling capacity service. So those problems are resolving. We are seeing, as I said, increases in demand as a result of the pandemic, and seeing greater numbers of flu, for example, and other seasonal infections. Talking to public health colleagues yesterday, I think there's a recognition that we've all been in lockdown for most of the last year, that you get that lower immune system, and so we are seeing an increase in those other seasonal viruses as well as obviously the ongoing COVID situation. So demand for all NHS services has increased quite significantly. What we're also finding is a stretch in workforce and capacity. So, as Suzanne has mentioned, all organisations are looking to do whatever they can to increase staffing and increase workforce. And the ambulance service have been doing similar as well, and also looking at working with colleagues in the police and the fire to see if there's anything they can do to support those call handling services as well.
Lovely. I think that's the trouble, because they can't get through to 111. They don't know where to turn, so they either go direct to emergency departments, or, as you say, they call the ambulance.
So we've absolutely recognised that, and investment has gone into that call handling service to enable that improved access through 111 services.
Lovely, thank you.
And 111 online as well. Get that plug in too.
Okay.
Apologies, all of those services, if you do contact 111, people will then get through to our clinical assessment services as well, just to make sure that because it's an automatic, pathways is an algorithm, we make sure that we've got that clinical validation as well by GPs and primary care nurses, so that we're absolutely only ensuring people attend the emergency department if they absolutely need to.
Apologies everybody for joining late. I got held up elsewhere, but I'm here now. Good to see familiar faces. And Joe, I think you're talking about the resourcing issue in the NHS, which I think we're all aware of.
Yeah.
Declarations of interest, Councillor Wood.
None. Thank you.
Okay, thank you very much, and good to see a second member from Portsmouth. I'm asked. Councillor Briggs.
Thank you, Chairman. To follow on from Councillor Hook, the question I get asked the most from residents is, where have all the doctors gone? And this is how people in generally feel. So with this extra grant doctors are going to get, does that mean there's going to be more availability? So people aren't ending up at ED because they're worried, and often people aren't satisfied with an online chat or being told to take a photograph of something that's worrying them. So is this grant going to improve things for the general public, please?
I think, in relation to the question, where have all the doctors gone? There, GPs have been there throughout, as have their wider primary care teams throughout the pandemic, working incredibly hard. I think we've known for some time that we have an ageing population in our primary care workforce, and therefore GP capacity in terms of numbers of GPs has been an issue, as it is in many other clinical roles as well. So some of that goes back to training, and additional training places are being put out. I think the role of general practitioners has changed quite significantly. And so, we're working very closely with them to look at how we can make that model attractive. A lot of the younger GPs coming out perhaps do not want to become a partner in a small practice, as is the current model. So again, we need to look creatively at how we can make sure that they have the right opportunities for them, be that salaried GP, salaried GP appointments, and also working in a more portfolio career, so they have alternatives which may suit them better, because we're finding that's they have different they're making different career choices, those younger generations of GPs. I think it's also really important to remember that the doctor is part of a team, and it's very much a team in primary care, and that a lot of the work that perhaps traditionally was done by a GP can now be done by the members of the team. And we're working really hard with practices to make sure they've got the right team around them, be that pharmacists, nurses, physiotherapists, other therapists, to support staff. And some of that may even not be clinical. And some of the examples of what Portsmouth group are doing, that shows what one practice is doing, but the other practices are doing things very, very similar. But I think we have to recognise we do have a sort of a national shortage of GPs, despite increasing numbers of coming into training. And so we need to make sure we're doing what we can to recruit GPs into the area and to retain those that we've got. So we're working really closely with our practices, using that additional funding that's come down nationally to see what we can do differently.
Okay, I've got a request to speak from...
Can I have a supplementary, please?
Okay, yeah.
Yeah. What are we going to do to stop the doctors that we have trained from going off to, say, Canada, Australia? Don't we need a system that it costs an awful lot of money to train a doctor, that they should give at least 3 years to where they've been trained? Because I'm not blaming them for going, but as you say, we've got to make it more attractive for them to stay. And I feel unless we solve this problem of doctors, which are people's first point of call, or should be, and I know we're going to have more hubs, so if you've got a bad back, you don't need to see your doctor, but the system at the moment isn't working. I get so many complaints that I feel I shouldn't really be getting. And I'm not giving all the blame to you, but it's very concerning.
Yeah, and I think, that it's like with all of these things, there are things we can do locally with our individual practices at the city level, and we work very closely, city council colleagues, but also working in partnership across Portsmouth, South East Hampshire, and across Hampshire and the Isle of Wight. But some of these are national issues. So obviously the training of GPs and other doctors is something that is undertaken nationally with the Royal College. That's not anything we can, well, we do try and influence it, and particularly looking at how can we make sure that the roles the GPs are being trained for are the roles they're going to come out. Because if that training's not right and you come out and the job looks very different to the one you thought you trained for, then that's not going to be attractive. So we're doing lots of work, and one of our local GPs, actually Dr. Nick Moore, who works for the CCG, has now got a job for Health Education England, in charge of some of the GP training. So we're working very closely with him to make sure that we understand some of the challenges and also some of the opportunities that are coming through that. I can talk mostly around Portsmouth. I think we have always had a recognition that sometimes it can be quite challenging in the city, given the levels of deprivation, and that may not be the same with some of our neighbouring counties. So there is a recognition of that, and some additional money being put in to help incentivise GPs going into those more deprived areas. So we're continuing to work at all levels to look at what we can do to support that. And I think it is also important that although we have a model that where we're used to seeing the GP as you said, as the first port of call, that isn't always the case and the best way. And the work we've been doing with our colleagues in Solent and practices in the city around physiotherapy workload, and actually having direct access to physiotherapists when you phone the GP. If you phone with a musculoskeletal problem, actually you're not referred to the GP, you're referred straight to the physiotherapist. And we found that actually that's a much better experience for patients, because they get the right support at the right time. The physio, and our GP colleagues will say the physios are better at looking after a lot of those issues than the GP is. So it's right that the patient gets straight to the person that can give them the best support. So again, we're looking at that as well, and that's been really beneficial and had some really good patient feedback.
Thank you.
I've got a question from Councillor Rob Wood.
Thank you, Chair. Joe, good to see you. Very quickly, there are a few things I was going to cover. First of all, is about training, and is about, first of all, incentives for younger doctors coming through and make sure they don't fall by. Obviously, having had children's social care, one of the things identified early was we had a lot of youngsters coming in who burnt out and didn't last the course, and we had a lot of seniors going sideways to get out of the headlights, if that makes sense to you. So we employed the technique a bit like Nick Moore, which is have a principal, whatever you want to call it, whose role is to mentor these and stay on board locally. The problem with Nick Moore going nationally is he's now national, which is
Wessex. I don't want to Wessex wide, not quite nationally.
What I'm saying is his viewpoint will be diluted, and I think we need to somehow bring that down locally to get locally people trained, if you see what I mean, and mentored, so that there is it works in lots of professions to do that. And it seems we start this, and then what happens is the principal whatever is now put into a management grade where he's not doing the job he originally wanted to do. So that's my first thing. The second one is about the loss of doctors going to Canada. You talked about incentives, and as HOSP, one of the things we need to know from you, the colleagues, is what we can do as HOSP to go and lobby government, go and lobby wherever, because basically we are a group of people who cover an area, who have an interest, and in a way we need the ammunition to sort of say, politically we should be going and saying, pay doctors more when they reach this grade, or pay them incentives to work hard. You know where I'm going with this, because saying that and turning it into reality is a concern right now, that we can all see how you're struggling, and we can all come up with lots of solutions, but it needs us to go and find a silver bullet to help colleagues out to make it happen, with the Royal College of Nursing or writing to that. So just a couple of comments about the principle, and two is you as colleagues supplying us with what we're going to be doing to help you out to achieve those goals, if that makes sense to you.
Yeah, thank you, Councillor Wood. I think one of the things we are struggling with is, and certainly our GP colleagues are saying, and it's not just in Portsmouth, that it isn't just about the money or the financial incentives, it's about the workforce and the availability of the workforce. And so there are some particular challenges around GP workforce, and training numbers perhaps haven't been, you know, again, nationally maybe haven't been as good as we needed them to be. I guess we didn't take account of an 18-month long pandemic in some of those 10 years ago. So we are definitely feeling that lack of workforce, and I think also have to recognise the challenges and the stress for people working in the NHS over this last 18 months, as there is in lots of other areas, may have made people to make different choices. But so absolutely, thank you for your support, and we will do whatever we can to provide you with the information that you need, and happy to have that conversation offline with Jane and see what would be useful. But again, it's not just about the money, it's about actually, you know, trying to get that workforce and attract the workforce. And we recognise that there are problems everywhere. So it is about, again, as we've just talked about, ED, making sure that people only go to ED when they absolutely need to, and we are able to redirect them back into primary care. It's also about making sure that we give people the right information that's accessible to them, about how to take, you know, to do self-care options, how to use the pharmacist. We're looking at what more pharmacies can do to support, and again, the roles of the wider team and making that more understandable to people. So we're doing a lot of work around that. So again, we're making the best use of those GPs where we can. And interestingly, your point, Rob, about the principle and the training, that was something we were talking about today with colleagues around the role for the Primary Care Alliance to try and attract GPs in, and those GPs just off who've just finished their training, and again, what additional training and support offer can we put around them, and then work within, you know, giving them sessions in those practices that are perhaps most vulnerable in the city, and doing it that way. And again, is that a model we can share with other partners? So we're really looking at that now as well. So thank you.
Chair, if I can just ask Joe one more thing very quickly. Joe, the other part was, you have alluded it, and lots of people alluded it, which is the sideways shunt, which is pharmacies, nurses at the practice, technology.
Yeah.
Doing right. One of the things that I think that needs a close look at is lots of times you don't actually have to go to your GP. The GP is just emanating trust. And I've known my GP. I've been very happy to go and see a nurse, or, as you said, a physio or something like that. It's just simply getting from A to B, being directed to that point, which is really important. The other thing is in the modern world, a lot of youngsters or of a certain age are very succinct with using apps to say, you know, ask the question, have you got a temperature, A, B, C, D, go to your, ring this number, or just take an aspirin. But a lot of older people aren't. They don't like phoning and then they will keep on going until they get to see somebody. So there needs to be an idea of looking at the whole spread of how you spread that resource front, and saying, if you're an older person, you want to speak to somebody. So even if it's somebody who's going through the same questions, if you see what I mean, I know people do, but can give that reassurance, as opposed to, we now got the NHS app. I'm not actually asking for a comment back. I'm just saying, if I was looking at that problem, I would say we need to actually analyse and examine the whole frontage to decide where we send patients and how they can access it self-help wise.
Yeah, you're absolutely right, Rob, and that's what we're doing, and also doing a big communications campaign with practices and with patient groups and with the public as well, to tackle all of those different fronts.
Okay, I have got a whole series of question people lined up. Councillor Agates, you had a question.
Yeah, actually, I got a whole load of them, Gemma, but I'll wait until we go through the minutes. It wasn't a question, yeah, it was. What's the chances of bringing in more pharmacy staff from abroad? My latest complaint that's levelled to me last night was a 2-hour wait at pharmacy to get the tablets that they've been given the jitty for is beyond a joke. And I'm well aware that this has been going on for a long time now, for reasons best known to myself. I've been there with my wife, and yes, I was extremely lucky in that I was there with my youngest daughter, who's radiology graduate, and her mate worked in pharmacy, so we didn't have to wait for 2 hours. But the number of times people complain to me about this 2-hour wait at pharmacy is really, it's been going on for too long now, too many years.
Did you want me to respond to so I guess it depends where the weights are, and I think, again, as we recognise that certainly when we look in the hospital, there can be long waits for the pharmacy, which can delay a discharge. So again, part of that big plan of working together is absolutely working with the trust and their pharmacy team and looking at how they can change that and create additional capacity to resolve some of that. With community pharmacies, it's a slightly different picture, I think, because we see they're independent contractors, and we have some very large community pharmacists in the mix. For example, Boots is one. They're a national organisation, as are some others. We also have some quite small local pharmacists. So the challenges for them to do that recruitment abroad are perhaps more challenging.
Sorry,
again,
I
wasn't aware of huge waits in local community pharmacists, but again, that's something our medicines optimisation team would work with them on.
Sorry, my question was particularly targeted at QA and
right.
what the possibilities were. Because you're getting staff from abroad, can you not get some pharmacy staff from abroad? I don't know what the other pharmacies are like. I know that my local pharmacy, the one I use in Horndine, is extremely quick. I don't have a problem with it. And not only that, but he delivers. But we're back to QA. 2 hours.
I think it'd be a bit unfair.
So,
Joe isn't really dealing with QA, are you?
well, no, but I guess in my role for the CCG, we do work with all partners. So, you know, again, to provide that assurance, the Hospitals Trust, like Solent, are also looking at international recruitment wherever they can, and to strengthen their teams. They recognise, you know, that there are some gaps and some staffing challenges that they have, and they're doing everything they can to fill those vacancies. And as I said, that the distribution of pharmacy to support discharge is a particular issue that we're focused on to make sure that those processes are speeded up.
I have got some comments on that myself as well, but I'll wait until I get down. I've got a few councillors waiting.
Can I just make the point that hopefully somebody from the NHS Trust was still here and still listening, because the stuff I got lined up from our minutes that we didn't go through would be applicable to them.
So,
well, you could have raised it while we actually had Susanna doing her presentation, but I'm going to call Councillor...
You're quite right, I could have done, but if we'd had gone through the minutes at the beginning, like, well, I normally accept that we do, then we wouldn't have this problem.
I've got Councillor Venter. Bentote, is it?
Yeah, thank you very much. Yeah, I'm new to this group, so interesting to hear all of these things. But, you know, representing Winchester, most of our area lies outside of the area of this particular CCG. But I just put the comment on the chat that we do have problems in Whiteley, and I know that there seem to be a number of recruitment problems and accessibility problems for patients getting appointments. You know, often being suggested that their appointment is several months away, which is, you know, it's just not how it should be. It's nothing really to do with this CCG, because we come under a different one. And in fact, I find there seem to be too many different bodies that are involved. I'm just trying to catch up with everything here and see who is involved. It's difficult to know sometimes who to go to discuss problems of a more general nature. But I'm listening in and trying to learn a few things. I don't think my problems in Whiteley are going to be solved on this in this forum, but we are fighting elsewhere to get some problems. I'd just say the problem in Whiteley partly is that there is a surgery there, and the CCG is unwilling to put in place a new surgery in the expanding part of North Whiteley where 4,000 homes are going to be. And the accessibility for Whiteley and its associated surgeries, which I think probably cover Parkgate, Titchfield area, is not good. So it's a problem not just restricted into the Portsmouth area, but there's problems in South East Hampshire as well.
Just checking if that's not that you can't cover that, can you, Jo, or can you?
I can cover a bit of that. So yes, I would absolutely agree with Councillor Bentote that the problems we're describing are not unique to Portsmouth. There are challenges across Hampshire and across the nationally really around GP access. For some of the reasons that I've described, some of ours are unique to Portsmouth, perhaps around the levels of deprivation, but it is across the board. I suppose the other part that's in my report that might be useful and helpful to flag is that the white paper, the Health and Care Social Care Bill that's currently going through Parliament is to sort of disband clinical commissioning groups and to create integrated care systems. So for us in Hampshire and the Isle of Wight, that will create an integrated care system for Hampshire and the Isle of Wight. So both the Hampshire, Southampton and Isle of Wight CCG and Portsmouth CCG will cease to exist from the 1st of April next year, and the functions of the CCGs will transfer into the Integrated Care Board. The idea behind that is really to create better integration and recognise that the NHS is a complex organisation, and to enable partners within the NHS to work better together, more collectively, but also to work better with local authority partners as well. So we will be working much more closely across Hampshire and the Isle of Wight, but I think what we're all really clear on, and that's in the guidance, is the need to continue those local place-based arrangements and working in partnership with local authority boundaries. And I recognise that in a place like Portsmouth with a unitary authority, that has been easier for us to do. And again, moving into the Hampshire and Isle of Wight integrated care system will enable that closer working, not just with Hampshire County Council, which exists, but also with those borough councils and district councils. So hopefully that will be a positive move for you all and enable that voice to be heard locally, but also across Hampshire in an easier way.
Thank you very much for that. I think that's that's a good point. As I said, it's difficult to know who to refer to a lot of the time, and
Thank you much.
different get in the way.
I could suggest, Councillor Bentote, that you could speak to Councillor Briggs offline, as she's the Vice Chairman of the Hampshire health overview scrutiny panel. So perhaps that's something that could be raised through them, but I'll direct it offline rather than doing it at the moment. If I could call Councillor Hook, please. Been waiting very patiently.
Thank you. No, that's fine. Thank you, Chair. It's just going back to something that Rob said earlier, and I have brought it, probably not at this board, probably like Councillor Bento say, we're all on different Hampshire boards across. We thought about doing a leaflet at doctor's surgeries. So again, you can have all the numbers, all the places of where you ought to go with different problems. And I believe that Fareham has issued a leaflet. And that was very helpful because, of course, we've got a captive audience with the vaccination programme, whether that be flu or booster at the moment. You're having so many hundreds of people through a lot of surgeries that you could just hand them that leaflet, and on the back of all the numbers of who to contact, where to go, and who to contact in such and such a, whether it's an emergency or not so much, whether you go to your pharmacy or whatever. And I believe that one of the Fareham surgeries has printed a leaflet and it's going down very well. I obviously not from that area, so I haven't got a copy of that. But it's maybe something that we can think of that we could hand out at vaccination centres while we've got the residents there.
Chair, just to come in as on from Fareham in that respect, Lynn's absolutely correct in that way. And we as a council in conjunction with the CCGs have actually issued all the various phone numbers, etc., of where people can get information. So, and I think it is going down quite well at the present moment.
Yeah, and certainly in Portsmouth, we have a shared communications team with the CCG and the City Council. And they work very closely with colleagues across Hampshire and the Isle of Wight, again using all the mechanisms that the City Council and other councils have to support us in that. So that support's very well received. Thank you.
Thank you much. Any other questions before I ask mine? Mine are more comments really. First one, Joe, since you did say you're willing to talk about stuff to do with QA and pharmacies, I did raise it with them at a meeting myself last week, but I've had some residents complain about they feel they were kept waiting before they were released to go until after the time the pharmacy had shut at QA Hospital, and they're then given a green pharmacy prescription, which is treated as a private prescription. So instead of getting it for the normal £10.40, they have to pay a private prescription fee. And I don't know if it's widespread. I can only go on hearsay from residents who have spoken to me about it, but they did feel quite miffed that they felt they'd been there all that time and sent away on a Sunday with a little green slip as opposed to a normal NHS prescription. So they've either been given the item from QA or been given a normal prescription.
Yeah, I've not heard of that myself, but really happy to pick that up with you offline, Councillor Mason, if that would be helpful, and to explore that with our medicines optimisation team and explore those residents' concerns. Happy to do that. And it's not something I can answer today with any clarity, but happy to look into it for you.
Strangely enough, it wasn't something that could be answered with clarity at the QA hospital either, but they said they'd get back. Well, they said they'd look into it. And the other one was regard to some of the comments from other members about online and other means of consultations. I've got to agree, it's not just the elderly that suffer. Again, with having Cosham Park House and the Portsmouth group in my ward had a fair few people complain that they get sent a text message telling them when they're going to have a phone consultation from whether it's a nurse or whoever. They then keep themselves at home, wait for that time, the time passes, keeps going, and they have nothing come through, or they might get half an hour later or 3/4 an hour later, they might get 2 rings of the phone and it drops, and when they try and phone back, they can't get through, they just get stuck at the receptionist or call waiting system, and they get the feeling that it's just been done as a way of clearing the when they're behind schedule, or just drop call. And unlike if you go into the surgery when you know you're going to be seen, you'll wait and someone will eventually see you. They feel that it's just really a case of they then get put down as, oh, well, they weren't available, or they didn't know anything, and they get another text message saying, oh, we'll make you do another consultation in 2 weeks' time. So it is the feeling of annoyance where people take time off work or phone call that doesn't come, or if it does come, it's a drop call. Obviously, people don't tend to complain to the local councillor when it works well, but they certainly mention it when they have issues. So,
yeah, I think we recognise that there are significant, as I've said, there are significant challenges in access to primary care services across the board at the moment. And that does create frustrations, and some of the systems that practices are trying desperately to put into to improve things do then end up with unintended consequences. And I think, as well as we see at the hospital, the busier things get and the more under pressure those staff become, the harder it is for those processes to work as effectively as they do when you're under less pressure. So, you know, the bed occupancy numbers, as we've talked about at QA, when that's at a normal level, which we would hope is 92 to 95%, those processes work really well. Once you start getting above that, as they are at the moment, it becomes really, really difficult because everything is stretched, and it's the same we see in primary care. Again, we're working really hard with our practices, all of them, to look at how we can improve processes and what they can do differently. I know you mentioned, Councillor Mason, that you've had lots of queries and lots of things in your post bag around Portsmouth Group. They recognise that they have some real access challenges, and they recognise that they're a big practice. They're working really hard to resolve those, and they're also really keen to meet with HOST members and councillors, for councillors to visit the practice to see how they're working and to see what they're trying to do to resolve some of the issues that they're very well aware that they've got. And I know Penny Mordaunt has been to see them and found that useful. Again, if you know, I know that offer is open to you if you'd like to do similar, to see how it's working and what they're trying to do. Because they are trying really hard, and we're working with them alongside all the practices to improve things, and as we've said, to try and look at that GP recruitment and recruitment of wider clinical teams as well.
okay, I know it is in my 2 ward colleagues' mailbags as well. We used to find that people were contacting all of us, but now we're finding it's different people contacting each one of us, but it is the same ilk, and it is always the same surgery. So, Councillor Agate, please.
Yeah, just to back you up on that, Chairman, even calling at my local surgery, which is in Clanfield, at 8 o'clock in the morning, you can be 16th in the queue. Well, that's all right, but you can carry on for so long with the telephone system as it is. But in the end, it cuts out and you have to ring back. And you can just as easily be back to 16th again. I now have an agreement with my doctor. I'll tell her when I'm available during the week, and she can ring me up when she gets a minute, and she's going to be calling me tomorrow morning sometime. I don't care when, I'll be here because I really want to speak to her. Oh, that's it.
Yeah, I think people do make themselves available, but then when they've taken time off or they've stayed in waiting for the phone call and it doesn't happen, and if you're at the surgery, at least you would know someone will see you. If you're at home waiting, you just feel, oh, completely forgotten. You know,
That's the lucky bit when you're retired. Well, not really, because you get all the aches and pains.
yeah, you're not really retired as a councillor. Any other questions or comments?
No, but one comment I could make, if you're happy for me to do this list of items which I pulled out of the previous minutes, if you're happy for me to do this,
I'm more than happy for you to do it.
I'll do a list of stuff and email that to Jane, and perhaps she can then get on to Ms. Crichton Young and whoever and get some answers.
And again, Councillor Mason, you know, I've contact with Portsmouth Group because they knew there was an aspect of them on the report today, and their practice manager their operations manager is really keen to understand some of those complaints that you're getting and to support and work with us to look at how we can improve things and respond to some of those, you know, investigate some of those queries that you're getting. So very happy to work with you and the other ward councillors on that, if that would be helpful.
Yes, if you're happy to fix up with us, we
Yeah,
would
yeah.
say I would phone them up, but I do phone them up and I never get through. So I have to use Shanks's pony to go up there and.
As I say, all the practices are working really, really hard, and we recognise that there are lots of improvements that we need to make, and people are doing the best that they can. But yeah, Councillor Mason, really happy to facilitate that conversation, and I'll have a conversation with the practice about how can we do that. And I know they've keen to extend you a visit, so to talk through what what we can do that will help. So we'll get that sorted for you. Thank you.
Any further questions, comments? No, thank you very much. And is there anything not on the agenda that people or anything else want to raise? Arthur, did you want to raise anything now, or are you happy to send everything through email?
Happy to do that through email, Chairman.
Okay, in which case, thank you for those people that have turned up today, and great to see people here answering questions and being available. That's always a positive. I know it can be irritating when people don't come along, but thank you for coming along today, and really appreciated the time you've taken to answer questions and save us to the end. So,
Lovely.
okay, you want to turn
Bye.
Thank you very much.
Yes, I'll do that now. One moment, please.
We're just turning off at the moment, so as in turning off the live stream.
Looks like you and me, Chairman.
Yeah. Oh, there's a load of officers there, but they've all got their cameras off.
Yeah, I can see that. That's